to the Doctor's Corner with Dr. Kline and Jonelle Elgaway.
Good evening and welcome to the Doctor's Corner on KA 360 Network. I'm your host, Jonelle Elgaway, and we are here with co-host Dr. Kline. Welcome, Dr. Kline.
Good evening.
Good evening. Tonight we are focusing on the topic of how to deal with pain if you don't have the option of pain medications. Guest Charlie Brunn is joining us to share his personal experiences dealing with pain without using pain medications. Charlie recently had surgery due to a crushed spine. We will also answer a few questions from our mailbag. The mailbag is questions that we were asked in previous shows on YouTube chat that went unanswered or questions that people have written in. If anyone would like to call in with a question this evening, you can do so at 415-915-2291. There are two ways to listen to tonight's show: through our website, which is www.cawnation.com, cawnation.com, or YouTube channel, and search The Doctor's Corner. And now, Dr. Kline, is there anything newsworthy that occurred in the last week that you would like to share with us?
Well, the huge news is that the AMA, as we mentioned, has come out in support of pain patients. And I just have part of the resolution here that I'm going to read from. It'll take about 2 hours, but don't worry. It's okay. Basically, they're saying that the no entity is the new word for us doctors. We're entities should use the morphine milligram equivalent thresholds as anything more than guidance position should not be subject to professional discipline, loss of privileges, blah, 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 solely for prescribing opioids at a quantity level above the CDC guidelines. How about that? All right. Also, we advocate against the misapplication of the CDC guidelines by pharmacists, health insurers, pharmacy benefit managers, legislators, government and private regulatory bodies in ways that prevent or limit patient medical access to opioid analgesia. How about that?
Wow.
That basically is saying you don't have to follow the CDC guidelines, and we're saying as the AMA, you should not follow the CDC guidelines. Of course, we've been saying that all along, but people listen to the AMA. They have a lot of clout in Congress. They've been around since 1895 when we got together and chipped in some money and said we'd like to have these people handle the political things for us. So that's what they're doing. And this is a wonderful thing that's happened. It's being picked up in a lot of blogs and being picked up in news articles. Just because these published, they're not going to be doing anything about it. But this is really big. So you can go online, look up AMA opioid guidelines 2018. Get copies, download. It's a little difficult to copy, but you can do it if you're clever. And you can start sending these to your doctors. What's the rule? In the mail. Or by fax. Do not take these things into the office and say, Doctor, have you read these? You'll just get a bad response. But physicians should be reading a lot of this because it's hitting the popular press. But these are very powerful statements. They are basically saying the CDC guidelines are dead. So there.
What do you think is going to happen next with that? Like, where do you see this going?
I think the big ship's going to start to slowly turn. We need to put out a lot more materials. We need to have some help from CME people. Doctors need to find out what's going on. A patient today was telling me she went to a nurse practitioner, and the nurse practitioner looked at her list of things she's taking, and the patient's taking quite a bit of oxycodone because it's got a terrible problem. And the nurse practitioner is a licensed medical person. says, okay, 30 milligrams. You just take one of these a day? No, I take two or three every 4 hours. Oh my God! Every 4 hours? Are you kidding? This is just raw ignorance. And so we need to put out some educational materials, and anybody that would like to help me, speak up because I have no office staff, and I'm eating so many donuts I can hardly breathe. Trying to get through this, but really anybody with an interest in CME. The problem is the CDC has put out this toxic materials for medical schools, training programs. Don't use this stuff; it's horrible. And they did it in a slick, hired these consultants with taxpayers' money, by the way. And these are all being taken around the country now by these zealots, telling people not to use opiates and to stay under the 90 milligrams. Well, that just got shot down. So I don't know how these medical schools that allow these fools to come in there and give broadcasts are going to respond to the AMA thing. So that's really the biggest news we've had on this program. Since the announcement that I won the Nobel Prize. But after that, this is really big. So, Jonelle, do you have a couple of questions, mailbag or one question?
Yeah. We have a question from somebody wanted to know if they can lose their period due to pain.
Absolutely. Women run the planet. Mao Zedong said half the sky is held up by women. Women are in charge of running our race and making sure that we have more of us. So women, their minds and souls, anytime they detect something is wrong, they stop having periods. And that's to protect the woman from becoming pregnant. Something wrong is going on. Now your body's pretty primitive, but certainly if you have a lot of pain, your body's going to say, hey, something's wrong, So don't have your periods because we don't want you to get pregnant. Long distance runners stop having periods because they are putting their bodies through such extreme stress that their bodies are saying, hey, back off. So periods are very sensitive to any kind of illness, and as a matter of fact, the doctors, when they ask about periods, if they get the answer back, they've stopped, or they suddenly became irregular, start looking for other things. Your thyroid's off, maybe you got an infection somewhere, you got a TB, it can be anything. So yes, you certainly can have an interference with your periods when you're in pain.
Okay. Other question is, why did my doctor take away Xanax instead of, or they had to pick either Xanax or pain meds, even though they've been on it for 9 years? Why did they have to suddenly stop?
Okay, well, this is part of the opioid, fear of opioid phobia, where people have become so phobic and afraid of addiction, they're just glomming onto anything. How this got started like wildfire. This is like the old-fashioned rumor. This just start down at the grocery store, and then pretty soon it just picks up and it goes wild. There's no reason whatsoever to force people into choosing. All you have to do is be sure the two together are not causing excess sedation. If they're not, you're fine. A lot of people need to take these medicines either for spasm or terrible anxiety that people have with their pain, and also it helps the pain medicine become more effective. So anybody that's doing this, you got to say to them, I read on the internet, not from Dr. Kline, I read on the internet that this is bunk. Do you have any evidence before you harm me? Show me. Where is it? It's time to stop being polite. I mean, it's always good to be, politically polite. But it's also time to start speaking up and say, Doctor, can you before you do this to me, can you show me evidence for this, or something I can look up? Because I really have a problem with this. Because I've read on the internet you don't have to do this, and so you doing this to me is what I consider to be negligent. Now, whenever we have disputes like this, Doctor, I'm going to call the Board of Registration in Medicine and see if they can help us settle this. To see if there is a policy somewhere in the state or the federal government or on the moon that says anything about stopping benzodiazepines because the CDC presents data from people who killed themselves in the streets with their addiction. And so you may want to apply this to them, Doctor, not me. Unless you have evidence that people like me have a problem. And you know what? I can't find any.
Okay.
So I feel very strongly about this because these are important medicines for people. And so I guess the question to come back to the doctor is, who would qualify for both of these drugs, Doctor? Nobody? And if it's nobody, where is this coming from? Are you just making this up? And that's really what somebody has made it up along the gossip chain. And it's just frank gossip. So there.
Well, and this leads into our topic for this evening. What do we do as patients dealing with pain if we don't have the option of pain medication? And we have here, we have guest Charlie Brunn with us. Charlie, are you there?
Hello.
Hi, how are you?
Yes, I'm here.
Hi, Charlie.
Very good. How are you?
Good, thanks.
Hi, Dr. Kline. How are you doing?
I'm dandy.
I agree with you 100% on what you said so far.
Okay. Well, we would like to hear your viewpoints. And I understand that you have a background in pharmacology.
Kind of. I work
kind
in
of
an engineering firm that builds plants. I wouldn't say I really have a background in it, but I have a cursory background in it.
Okay, some knowledge. Uh-huh.
Hey, Charlie, excuse me, can you go closer to your phone or when you talk, please? Charlie?
Yes.
There you go.
Is that better?
Yep, thank you.
That does.
I had it on speakerphone.
Gotcha.
Can you hear me better?
Much better.
Yep. All right, so you have some ideas, and just go ahead and tell us. It sounds like you've got some interesting things. Mm-hmm.
Yeah, I'm 68 years old, and I led a kind of a idyllic life. I've never been really injured or hurt or anything. I might hit my thumb or something like that, but no real issues. But I crushed my spine about 119 days ago. Not that I'm counting.
Right.
And it's amazing the kind of pain that I've never experienced before. I get to experience every day. Allergic to Percocet. Not big on taking opioids, although they've been offered Turbidol and etc. So I went with CBD oil, and because I have a little background in actually working with these people, I got a hold of some CBD oil from a company called Charlotte's Web, and it's 90% pure. And as you know, the FDA hasn't validated any CBD oil company, so you have to be very careful. It's relieved a lot of the pain, but only for a short period of time. And I've actually had to do a number of things to talk myself down from the aggravation factor of dealing with the. I have an L4, a crushed L4 to be specific, and it affects your legs more than anything else.
That's awful.
Yeah, it has not been fun, and it's not fun. Get a whole new respect for people in pain. The only good thing to come out of this, when I see people in pain now, I stop and see if I can help. I mean, that's the only good thing that's come out of this. But you have no idea how many people are in pain till you ask them. And then you realize, I would say maybe a third of the country's in pain. I mean, it's amazing once you start talking to people and looking at them. But anyway, point being is I don't take a lot of serious medication for that. So I resorted to something less, but I'm sure with supervision you'd be able to take oxycodone and whatever else you need. Anyway, that's my my limited perspective at this point.
Okay. And why would you need supervision for the oxycodone?
Oh, mostly because I have a rather addictive personality. The first time I had a cup of coffee, I knew I was addicted. I would take it to a point where I wasn't sure where the cutoff line is. No, you don't need to take any more. Yes, you need to take more. I would need some guidance in that area. And it looks to me like the Medical Association doesn't offer guidance. They offer prescriptions.
Right.
They offer all you want, but they don't give you any guidance on what to take, because that takes time.
Right.
Sure, with some doctors, I'm certainly not talking about you, but with some doctors, I just don't think they take the time to guide their patients through well, I know they don't. I mean, you've got 72 people a day dying from overdoses, so it's not because people are being guided. So
right.
Anyway,
you've tried the CBD oil, and it helped at first, and then didn't help after that. Okay. Have you tried?
Well, it doesn't last long. The effect on that's only about an hour and a half. I mean, it isn't a long-term thing no matter what you do. I take it twice a day, once in the morning, once at night, so I can go to sleep.
And does that help you sleep?
And it does.
Yeah.
Yes, it does. Absolutely.
All right. Have you tried
to calm down the? Go ahead, sir.
Have you tried a little back brace?
Yes, I have one.
Okay. Yeah. Does it help?
It certainly does.
Okay. I find that folks with back, you can buy this $20 back brace at Dr. Leonard's online, $20.
Oh, really?
And it's got 2 sets of Velcro. In other words, you tighten it with one set, and then you tighten it with a second. And basically, the pain from a crushed vertebra is coming from the bone fragments moving. See, the reason that we put casts on people is not to help it heal; it's to stop the pain. Because if you don't, you stop the motion of the little broken pieces of bone. So in your back, but these Dr. Leonard's braces, I mean, it's worth $20. You know, you can give it to your cat.
I'm on it, my friend. I'm on it.
Okay, Dr. Leonard's. It's kind of a fun website. They have all kinds of strange things. But anyway, their back brace, I've used them for years. And people really do respond. As a matter of fact, one guy, this got this terrible back pain. He's buying one every about 3 weeks because he wears it all the time. And this is not some $300 brace,
right.
So now you mentioned you had allergies to the oxycodone. What happens when you take it?
Not the oxycodone, to Percocet.
Percocet, okay.
Right.
And what happens when you take it?
Oh, I get itchy.
Okay.
Itchy.
Okay, that's actually a very common occurrence for all narcotics. Yep, itching is really a problem. They say that the itching, if you can take it a couple days and you can put up with it, you can take antihistamines for this particular itch. And it doesn't you don't have to quit if you can put up with the unpleasantness.
It does go away, it seems. It did for me.
Yeah, and it does tend to go away, but it's maddening. But that's not necessarily an allergy. We kind of think of that as a side effect.
Yeah, got it. Yep. Yeah, that would make sense.
So, there are people dying every day, as you pointed out, but these are people in the streets.
That's correct. Yeah.
These are people dying in the streets. Yeah. And based on my research so far, I can almost say that it's virtually impossible for a person taking prescription drugs, even with benzodiazepines, to overdose. What happens is you just get real drowsy and then you wake up. Now if you're drinking a gallon of whiskey with it, you're going to have a problem. And that's the most common medicine in overdoses. And even though the CDC says these are opioid-related deaths, they are also alcohol-related deaths, and they are also cocaine-related deaths, anything that the person was taking. So now have you found anything else like, relaxation techniques or different exercises that help. They generally don't, but each person's different. Yeah.
Yeah, some exercises do help. And if I the good news is I can sit in a chair in a certain position, and it seems to relax everything, and I can sit there for several hours without pain. I just like to get away from the pain, because you mentioned earlier of pain and women having their periods and they change. Well, same thing happens with pain in your mind. It's amazing how my brain function changed when my body had to deal with pain, when the brain had to deal with pain all the time. Mm-hmm. It's interesting what happens to you. It definitely affects you. It affected my blood pressure. Mm-hmm. I mean, definitely, my blood pressure jumped right up.
Yep.
From nothing but pain.
Well, see, your body is getting signals that something's wrong, and actually high blood pressure can help pump more blood around. So your body responds to that. Yep. So how is your back pain keeping you awake at night?
It was CBD oil. It helps me relax. My problem is my legs twitch because of food in the nerves are trying to reconnect or something.
Oh, Charlie.
So I get twitchy legs.
There you go.
Okay. Do you drink beer or wine?
I have 2 glasses of wine a night.
Okay, you can, if you're not taking opiates, and actually you can learn to drink a little wine with opiates, but you have to kind of work up to it. But if you're not taking any opiates, you can certainly have a glass of wine, or before you go to bed to help you sleep. Believe it or not, alcohol, in the old days of drinking whiskey before the operation, it does have a mild effect on pain. It's not real huge, but it does help. So if you didn't have anything, you were on a desert island, alcohol would help, especially because after a while you can't sleep, and then you get depressed and you make your pain worse. It gets into a downward spiral. So sleep is important. And you can short term, you can try Benadryl and things like that. Wears off after 2 or 3 days, but you can try a little Benadryl and or the wine. Probably shouldn't take the two together.
I should have met you when this first happened. First couple of weeks, I bet I didn't sleep 2 hours.
Charlie, could you go near your microphone a little bit better? We can't hear you. You're muffled.
Yep. Sorry.
Oh, there you go. Mm-hmm.
I'm sitting in my car, actually. I just pulled up. Can you hear me any better now?
Yes.
Yeah, that's good.
Yeah.
Well, it's really hard to deal with things without pain, and some people choose to do that, which is fine. Each person should be able to choose their medical care, no matter what it is. This thing of forcing people off medicines, we've never done that in medicine. We don't force people to stop taking medicine. I mean, if the FDA comes out and says,
why is that happening? Why is that happening? Why is that happening?
It's happening because the fear of addiction, phobia, is so great that people say, wait a minute, we just get rid of this stuff, we won't have any dope fiends. Well, it's the same thing about alcoholism, back in the 1920s, when Prohibition lasted 14 years. And the reason it stopped was crime. Not that it didn't work. They claim actually that there was less drinking. But then, of course, you've got to say, well, are these really alcoholics, or people just drinking a lot, or they can't blah, blah, blah. But technically the program was mildly effective, but they stopped it because of the crime. And look at the crime we have. I mean, it's just awful. And so the crime is created by the shortage, and, it just makes things worse. So it's interesting that about mind over matter. In wartime, the soldiers request pain medicine for their wounds only about 30% of the time. But people who are injured in automobile accidents and go to the emergency room ask for pain medicine about 90% of the time. So there is a little something about mind over matter. We don't understand what it is. But, the soldiers are given all the morphine they want. It's not like they had a shortage. They have tons of it, in the military. And there's no restrictions, but a lot of times the soldiers don't ask. So, I don't know, mind over matter.
I have a question, Charlie. I know you're on CBD, or use CBD oil. Does that work the same now as it did when you first started taking it? or using it?
It actually works better. It seems like, I don't know how to describe it. My system seems to be working a little more. Different parts of my body are working better together now. And it seems to relieve a little anxiety. Mm-hmm. And maybe that's because the pain has gone away somewhat. So, I was getting very anxious from pain. Pain definitely is a depressant. It definitely makes you depressed. And it definitely affects anxiety levels. At least it did for me.
Mm-hmm.
And I just can't really relate what happened with CBD oil to the fact that I have very little anxiety now, and I have a bit better handle on it. Or maybe I'm used to the pain. I'm not sure. But it seems to have helped in that area specifically. So
is it expensive, Charlie? I know nothing about it.
Yeah. CBD oil is about, if 90 proof, is about $110 for a bottle that lasts about 30 days. But you got to remember, CBD oil is not regulated by anything. No FDA, no anything. So anybody can tell you they're selling you anything. I work I work in the industry where I did some work for this particular company, Charlotte's Web in Colorado. Mm-hmm. So I spend time in the lab. I spend time to see what they do. I know this stuff is pure, but I also have heard horror stories about people that have product that isn't even close to being
contaminated.
Yeah, exactly. Because there's no regulation. The FDA has not got their act together enough to regulate it, or
they really should. They regulate things in drugstores. They don't just regulate prescription drugs. They regulate everything.
Correct.
So, so I don't know why they aren't involved. Probably the fear of addiction phobia, maybe governing that. And I heard the federal police want to make it a class 1 drug, which is like heroin, the worst drugs in the world.
Right. Well, technically it is a class 1, but they don't enforce it, which is really weird. It's very strange. It's a very weird situation. By the way, the best use for CBD oil, is actually used for pets. Pets, particularly if they're having trouble with lightning. Apparently, it's fantastic for dogs.
Well, that tells you the stuff works. You can't get a placebo effect with your dog.
Biggest growth in the industry is with pets, believe it or not.
Okay.
Very interesting.
Well, it's very interesting. Your perspective is very interesting. And now we want to, maybe have some callers call in with, what they're doing. From my standpoint as a doctor, I just find it so depressing. We're even having this conversation. But, a few doctor things you can do. The back brace, Dr. Leonard's, if you have a back problem, $20.
I wrote it down.
I'm a big fan of plain old aspirin, 2 of them every 4 hours, or you can take a leave.
I take aspirin every day.
Okay. You can take it every 4 hours, and it helps with the inflammation, which helps with the pain. You can add Tylenol. You can always add Tylenol to the NSAIDs. Tylenol is the only other painkiller we have. So you can mix it with any other drug, but you got to be careful. You don't want to mix aspirin and Aleve together, or Motrin, or those.
Yeah.
You just pick one or the other. But you can always add Tylenol. And Excedrin and the old-fashioned APC tablets contained aspirin, Tylenol, and caffeine. So what the heck?
I live in the South, and that's what they take down here. It's fantastic.
Okay, well, you can add a little caffeine to your regimen, tea or coffee or Coke, whatever, and, a little wine. If you're not taking anything, you can try a little wine during the day. It's really kind of sad, but people that are completely cut off just stay almost drunk all the time because it works some, And certainly we don't want to recommend people.
Don't think it doesn't cross my mind.
Yeah, okay.
No, seriously,
give it a try,
what I do in the daytime, what does work though is coffee, believe it or not.
Okay,
I don't know what it
caffeine.
is in caffeine. But,
well, it's the caffeine.
I don't know what that is, but
you got these old remedies, might as well try them out. Okay. So.
All right. Well, we have a call.
But, again.
Oh, go ahead, Charlie.
Go ahead.
I was just going to take a call.
No, hold on. I'll shut up. I'll shut up and listen. Go ahead.
Okay.
Well, you're going to still be here.
Yep.
Caller from area code 212. What's your name and what's your question?
Hi, Dr. Kline. Hi, Jonelle. It's Julie in New York. I actually want to make it for the record, I don't believe in any replacement for narcotics, but I'm a consummate consumer. At first, I was very much, no, I don't want to do this, and I figured they're going to come after everything I'm taking. So this is more for people who have metabolic disorders. I found a few things that are, one of them, before I dismissed CBD oil as not working, I thought, let me buy a bottle of $220. I spent my birthday money on that. And I bought a bottle for $45 just to compare the two. Because if I'm going to dismiss something, I want to make sure I've it. Okay, $220 one. If you have no insurance and no ability to get anything, it's better than nothing. That's if you want to spend $220 every 2 weeks or a month, depending on how much you want to take. It's delicious. It tastes like very high-end black tea. The $45 one, which was recommended to me by a woman I met at the sarcoidosis conference, tastes like the Great Lawn after a Grateful Dead show. It's basically green sludge. It tastes so bad that you don't even want to take it. But I did try it. It doesn't work at all. The $220 one, calming. I felt a little bit of the inflammation going down, but not, it doesn't compare to any narcotic in price or for any reason. It's only, I would say, if you have nothing else and you have no health insurance, then, I'm not going to promote the brands. I just want to tell you the prices.
Right.
A chronic pain okay, and the same woman who told me, she actually said, this one is specific, and I posted it on my tweets. This CBD balm actually works. I'm obsessed with it. I put it on the back of my neck for migraines. I put it on my abdomen for cramps. I put it on my chest when I was congested. It's kind of like Vicks Vapor Rub, but milder, and I love it. But I don't know about the other brands. She told me about this one specific brand, and I bought that. I just ordered 2 more jars because I let a friend try it, and she kept the jar. And I let my psychiatrist try it, and he kept the jar. He liked it so much.
So you put this on as a cream.
It's like a gel, almost like Vaseline.
Yeah, okay.
An ointment. This particular, I don't know, am I allowed to, I don't want to promote it because I have nothing to do with the company, but
I don't care. Go ahead.
She tried them all. All right. It's called, there's only 2 websites that sell it. It's called CBD Clinic Revolutionary Pain Relief. That's it. And it's got a little hemp plant. And I get this severe. There's different levels. Again, not a replacement, but
better than nothing. Yeah,
and I like it for migraines. The back of the neck, and I put it on my temples. It didn't burn. It was like it didn't burn as much as peppermint oil, which is another homeopathic.
Right.
One of the chronic pain patients told me, now this is for people, I guess more for women who have reproductive issues and sinus, for everyone who has sinus, anything that's like clogging, any airways. I have lung disease, which hurts. Serapeptase, I think that's how to pronounce it. High potency, 120 SPU. $7, GNC, 90. So you take 1 a day. It's not one of these supplements you have to take 5 times a day. It's just 1 a day on an empty stomach. I've noticed a difference right away. Okay. Sinus is cleared up. Breathing a little bit better. The inflammation. Advil, I was taking 1,600 a day. That went down. I haven't even gone to the doctor for a prescription Advil. Okay. I don't feel like I need it. Again, not a replacement, but it's good if you have an inflammatory disease. it basically breaks up the scar tissue, and it clears out the tubes. So if you have reproductive disease, lung disease, sinuses, I noticed earwax, it's just clears out.
Now, which product are we talking about now? Just to be
the
clear.
last one, I'm sorry, I speak so fast. Serrapeptase.
Okay.
S-E-R-R-A, sorry, glasses.
Yeah.
S-E-R-R-A-P-E-P-T-A-S-E. It's an enzyme. You can get it.
It's not CBD.
No, I did.
Okay.
The CBDs, I mean, as I said, if you have no insurance,
right.
I would go for the $220 one. Because the $45 one is so disgusting. I've never tasted anything so gross.
Yeah, I was out with my wife the other day, and we were down by the container store that I go in all the time. I don't know, I just can't stop buying containers. And in the little mall nearby, there's a CBD store. And I'm going to go in there and start asking a lot of questions because I don't know a lot about it. But chemically, this stuff is a cannabinoid, and we have receptors in our brains for cannabinoids. So it may well have a biochemical background. But you see, nobody's researching it because of fear of addiction phobia. My God, we can't study that stuff. Everybody will turn into dope fiends and kill us. So, it remains. I mean, here we are. We're having this show about people not treated for pain, and we're talking about going out and getting herbs, and funny oils and stuff that are not regulated. I mean, that's kind of awful, But, hey, right now, to help people out, these personal experiences are just fine, and you can try this stuff, I mean, better than sitting around in agony, feeling like you can't do anything. See, I think the worst part of diseases is feeling like you can't do anything about it. And that's why palliative care is so important. Well, I'm sorry, we can't do anything about the underlying disease, but hey, we can make you feel better. We'll give you this materials and these medicines and stuff, and you'll feel better. And I think people then have some hope that they have control over their disease. So thanks for the advice and the specific nature of things. And I was wondering if there's anybody else out there that would like to volunteer things they have found worked.
Yeah. We actually have another caller, caller from area code 980. What is your name and what's your question?
Hey, it's Jessica. I don't really have a question, but I have had some success with herbal remedies. And I think that people kind of forget about it a little bit. Like something as simple as something you find in your backyard as a dandelion can actually help us. There's several different uses for it. But, for example, I have 3 aloe vera plants. They're not just for burns. Do you know that it actually can be used for an antibiotic?
Okay.
It can also be, it has several different uses. I mean, I highly encourage everybody to look into that. Remember that all of our medication came from a plant.
Right. Yeah.
So, I mean, it's like kind of a good thing. You've got valerian root. That's something that you can actually grow yourself. There's many things that you can actually grow. Valerian root acts as a muscle relaxer. And a lot of people have had that extremely effective or found it extremely effective. I have multiple books that I use, but personally, I mean, lemon balm, that's another one that's really good. It actually helps with your nerve issues, too.
Is there a central place, Jessica, where people can go on the web and find out about these things, or?
Honestly, I have I have a large collection of books. I mean, yeah, just type in herbal remedies.
Okay.
Or what plants can you use for medicinal purposes. And it'll leave a list of books, and a lot of it will take you back to Pinterest, but I promise you they do work. I know inflammation, you should hear me up, and I know a dandelion will actually help with that, a common weed that we just normally run over. But check it out. I promise you won't be disappointed.
Yeah, the American Indians, had all kinds of remedies and stuff, and to pass them off as foolish is really not very scientific. Science starts with curiosity, and then moves to doing studies and proofs, and you get 10 people together and 8 of them say they're benefited by this particular brand X herbal remedy. Hey, you can't pass that off. And traditionally these things have, and as you point out, antibiotics come from fungus that grows in the dirt. And the Taxol for breast cancer comes directly from the yew plant that people plant in their front yards. The poppy plant, for heaven's sake, oozes this black tar that if you fiddle with it a little bit, you make morphine, and guess what your brain makes? Morphine. So I encourage people to give these things a try, and that's a good suggestion, just going to herbal remedies. I mean, if you got 100 herbal remedies, not every one of them is going to work, but then not 100 medicines work either, so...
Well, and didn't you say that a lot of pain and a lot of our health issues have to do with actually inflammation within our body?
Yes.
Well, a few years ago, I got on this kick of trying different diets, and I found all these different foods that have anti-inflammatory properties, and it really changed a lot of things for me. Some examples is alfalfa, almond butter, artichoke, asparagus, avocado, basil. I mean, that's just some of them. I have lists of them if anybody wants it. But, by eating certain foods, that could really help you out too.
Okay. So where can people find information out about that?
I just found... Go ahead, Jess.
I was about to say, I can give you a book.
Yeah,
if you want to put it on the website for recipes for inflammation.
Okay.
Yeah.
Well, after the show, if you want to post your email or something, this is, we're like living in a prison camp, or a concentration camp where they've cut off important supplies. And of course, that's pain medicine for us. But so you have to become clever, and try different things, learn from other people. Hey, what worked for you? I'm kind of a scientist, so I'm having a hard time with this. But on the other hand, if I was in a concentration camp or a prison of some sort and they weren't giving out pain medicines, hey, I'd do the same thing.
Yeah.
Well, it's kind of forced us into it. I know I started researching it immediately. Like, as soon as this mess started, I was like, you're not going to leave me, because I was already in so much pain that I was on the verge of going insane. I couldn't take it. So I started researching different ways, tinctures and things like that. And you can make it like, it's just regular plants everywhere. And they have all these different...
that's what I'm saying, avocados and stuff. This is like living in the caves, 50,000 years ago, Org. Oh, hey, Org, you got any herbs? Because I'm sure all along the way there were always somebody designated, as healers. And, and they learned through the years how to do these things. Opiate medication has been known for 5,000 years. And now the CDC says, they don't work. So here we are having a show in the United States of America about what you do when they don't give you any pain medicines. So besides my being horrified, maybe we have other callers that have found things that help them that are not opiates.
A lot of people dropped because we were on with other people.
I scared them off.
If anybody wants to call in, please call in. The number is 415-915-2291. I keep seeing on YouTube chat wild lettuce. Do you know anything about that?
No, I don't know anything about wild lettuce, but you got to be careful. You got to know what you're doing. There's a plant that looks like a carrot, a wild carrot.
Uh-huh.
It's hemlock.
Oh.
Deadly.
Yeah.
Hemlock's in the carrot family. So if you're out there doing your own herbs, not buying them from somebody, be real careful. But no, I haven't heard about wild lettuce.
Okay. Yeah. If anybody wants to call in and share about that, because I've heard about that before too. Another thing is there's a lot of people like to take supplements. I know. One thing I do is like when I'm not able to eat, like if I'm going through stages where I can't keep food down, or my pain's too high, what I've done is those anti-inflammatory foods, what I'll do is I'll mix those with berries and, kale and stuff like that and make them into smoothies. And I'll get them down. That way I have a lot of nutrition packed into something very small. But at least I'm getting it. And I know a lot of other people have problems with that. So that's a really good way to do it. So. We have another caller, a caller from area code 209. What is your name and what's your question?
Hi, it's Ariane.
Hi, Ariane.
I was calling, I was kind of following up with Jess's phone call. Valerian is a really good herb, like she said, for relaxation and muscle spasms. I know a lot of people are getting cut off from a lot of the anti-anxiety meds too, and some herbal remedies for anxiety and nervousness can include chamomile and lemon balm and passion flower, which are all pretty easy on the system. They don't have a lot of side effects. Valerian sometimes can be a little harsh on the liver, but it kind of depends on the patient and how much you're taking. Some people have nightmares on valerian. What's interesting too is some cats really like valerian. The ones that aren't susceptible to catnip actually really like valerian. So that's kind of an interesting little tidbit.
I kind of heard that valerian is one to sort of watch out for, not get carried away with it. And it sounds like you're sort of saying the same thing.
Yeah, it can overload the liver. I used it for a while for sleeping because I have a really hard time with sleep. My sleep cycles are almost reversed. My cortisol levels are almost nil in the morning when they should be pretty much at the highest level. So my sleep cycles are really screwy, and I used to use it and then do 2 weeks on and then 2 weeks off.
Okay.
And then as far as, I live in California where medical marijuana was legalized a while back, and now it's recreational here. I didn't have much luck on smoking marijuana or doing edibles or anything like that myself. I know some people find some relief with it, but I do make my own kind of like a tiger balm recipe with infused oils with cannabis that works okay. I mean, my C-spine injury goes way beyond things like that. I mean, the reality is that opiate medication was the most effective pain relief that I had. And when I got taken off of it, what's ended up happening is my health has declined considerably, and my underlying condition of I have chronic fatigue syndrome. And what's happened is that the pain has caused pain-induced hypertension, and it's also led to weight gain, about 10 pounds per year over the last 5 years.
So you've been off meds for 5 years?
Yeah.
No meds in 5. Oh God. You know, I was just sitting there.
Well, the thing is that I did have meds during, for little periods of time right after surgeries, but, and ironically, Dr. Kolodny likes to say, oh, we're just experiencing withdrawal and that's what the pain is. That's just nonsense. It's total and utter nonsense.
Well, withdrawal only lasts 2 weeks at the most anyway. So if you're beyond that and you're still in pain, I just had a thought as you were talking and listening to your story. We recommend that people contact their board of registration in medicine and, and put in complaints. But you know what? If you wrote a story about your experiences and you're now several years into it, it might be interesting for the board to read that. And you could put it in
I
as
would be perfectly, yeah.
Yeah, you could put it in as
totally into it.
Technically as a complaint, but you can say, here's what it's like for me after 3 years, and describe how your life has gone down the toilet. Start off with what it was like when you were on the medicine.
Dr. Kline, I did a tweet today because it's kind of like this Thanksgiving is the first Thanksgiving I'm not being able to spend with my family. I can't travel anymore in my car. I used to be able to travel as a passenger in the car just fine, but now I can't. And on top of that, I've lost a lot of who I was. I was a very active person. When I had pain relief, I could turn down the volume of the pain, and I could garden, and I could do house, stuff like painting rooms and helping with the remodel of our property. And I'm an artist, so I was creating art and all of that. And a lot of those things have been actually taken away from me merely by the fact that I don't have adequate pain relief anymore.
Well, you really got to tell your story.
And then it affects your relationships, too. I mean, you don't have intimacy, because being touched, and that actually is painful. And it's just really sad that we're now in this situation where we're fumbling around in the dark trying to maintain any quality of life, which really is almost impossible to do without adequate medication.
You really have a good story, and what I've just heard, I think you write that up as a little story. I'd be happy to get a copy of it, and Jonelle would, because we're collecting stories like that. And this is not I'm in pain. This is a story about how your life has gone down the toilet. The fact that you're not going to a celebration that we all go to is just so tragic. I can't believe it. But we've got to get these stories out, and you can send it to your newspaper. What the heck, certainly send it to the Board of Registration in Medicine. I would also start sending things to the Board of Pharmacy in the states, because, they're in charge of the pills. I mean, pharmacists are in charge of the pills. So I think they need to know too. And the more people, more professionals that read these, send it to your legislators, say, look, I'm not campaigning for anything. I just want you to know this is what it's like. And I was thinking even of little stories about what my day is like. I can't get out of bed in the morning for 45 minutes. I have to do.
I'm one of those people. I'm one of those people who really push through pain. Okay. But I also pay for it dearly a lot of the time. I mean, I don't sit around feeling sorry for myself. But that being said, the reality is that it is wearing on my body and my mind how much I am losing. Every year things get worse, and my health is declining. And I think that a lot of people are going through the same thing. And it's actually, to me, it's criminal. It really is.
Well, it's interesting that if I'm drunk and driving in my car and my passenger is killed when I run off the road, that's called manslaughter. Indirect manslaughter there's two kinds of manslaughters. Anyway, it's manslaughter. But when a doctor
involuntary, right?
And involuntary. If a doctor takes a person's medicines away, like you, and ruins their life, that's pretty close to manslaughter. And of course, when people commit suicide, which you're not going to do, because we're going to talk later. This is heinous. This is god awful. You're very articulate, and if you write up your story and make it kind of a journalistic style, you can use that in a lot of places. You can use that in the newspaper. You can use it for legislators, and say, I just want to make you aware of this. And here's what happened. That's it. You don't have to say I'm beating a drum for anything. Say, this is what's happened. And you might want to send it to the CDC. And you might want to send it to the FDA so that they know what's going on. You can send it to the White House. Because you're
so far I haven't had good luck. I did the last resist bot letter that I sent out to my legislators. I got responses by email, and they were basically very dismissive. They say thank you for your voice, and it's very dismissive. Although I have noticed that the form letter language has changed to where it is we recognize that people may need this. So they are hearing us, but the rhetoric hasn't translated into changing legislation or changing the narrative to the public, which is actually going to be key in how we change things. And I think that once we get public sentiment, which I don't know how to do when the media refuses to tell this story.
Well, yeah.
But once we get public sentiment, we might be able to force our legislators to do things.
Keep at it, because now with the AMA out saying, hey, something seriously wrong here with the CDC regulations. I mean, these are powerful statements, and some people may become more receptive. So once you've got your little thing written up and ready to go, keep sending it back again. And say, you don't have to say do anything about it. Say, I want to make you aware of this. And then the legislators, you see, they like to figure out solutions. If you give the legislators solutions ahead of time, a lot of times, yeah, right, we're never going to do that. But think about who you can send it to. It doesn't hurt to put stuff in an envelope, And even though you don't hear back, that doesn't mean they're not reading it, A lot of times they put it in a pile. And they go, hey, we got 10 of these this week. So that's why it's important to get your stories out. Everybody, don't be shy. Don't feel like, it's not going to work. When I went to the voting booth, 3 weeks ago, I was thinking, is this really going to matter, me going to the voting booth? Yeah, it does, because we're working as a large group. So never feel like your own story or never feel like your voting is not going to count, because it's what piles up. And if we don't go, nothing's going to pile up. And if we don't send in things, nothing's going to, legislators are just waiting for information. And even though they respond, it's what starts to pile up. They're down at lunch with their other legislators, gee, Barbara, do you get any letters about this, these people's lives being ruined? See, and this is kind of long. This is kind of long term also. You see, a lot of people write in, they say, I'm being cut off. But you've got a story where you were cut off a long time ago. And here's what's happened. And if you were going through withdrawal, that would have been over in 2 weeks. That's as long as it lasts.
Well, the thing, too, is a lot of us use the multimodal approach from the very outset. I was one of the rare few who started on opiates. I had a serious neck injury, and it wasn't like I tried other things right off the bat. I got put right on opiates and muscle relaxers. But the thing is that once I went off of them for an extended period of time, my pain got worse. And we're talking, months. And so I went back on them and had good pain relief with them.
Okay, so you got a perfect story.
I know, I'm personal experience.
Yeah, perfect story. You see, because when legislators read these things, they don't understand, they think, chronic pain. Yeah, I'm sure. But you see, you've got a nice little story where you were on, then off, then on. And, you got to see the differences. And that kind of story really, really is important. So feel free to share that with me. And, we can work on it together if you wish, or I can put it out in the form of a tweet. But you have an ideal story. So don't put
I'll try to compose it.
Yeah, it's hard.
All right, well, thanks, Dr. Kline.
All right, we'll catch you later.
Thanks, Erin.
Okay, bye-bye.
People are asking about HHS and what are they going to do, if you know?
Say, ask again.
They would like me to ask you, Dr. Kline, what about HHS and what are they going to do soon? Do you know what they're talking about? The Human Health Services?
Human Health Services. No, I don't know what they're up to. But, this AMA thing is going to need to sink in because everybody's got egg on their face. Mm-hmm. Because everybody, including our beloved Medicare administration, is going to start in January cutting people based on the the MME cutoffs.
Right.
And when they read this from the AMA, and no matter what, people, like I said, people still respect the AMA. This is a bunch of doctors. They're going to have to sit back and think about what they're doing. And with stories like we just heard, it's going to turn. It's going to turn. And, the old civil rights song, keep your eyes on the prize. Mm-hmm. Hold on, because this cannot go on forever. It really can't.
Yeah. We have another call. Do we have time? Is that okay?
Yeah, go ahead.
Okay. Caller from area code 606. What is your name and what's your question?
Hi, my name's Jamie, and I had a question for the doctor. I wonder what your opinion is on, and I might have missed this already. I missed a few minutes, but on any kind of, there's a new shot, I guess, and it's called ketamine. And I don't know if that is helpful or if that is something that, what is ketamine? Is that something for chronic pain patients?
Well, it's actually was an anesthetic used in children. So basically, you're trying to reduce the pain using an anesthetic. This is, in my view as a physician, this is still on the list of things that people can use, but it's low on the list. And these are the kind of things you would try if your doctor knew what they were doing and weren't cruel to you, would try as much as opiates as possible. And if they failed, see, then you can go try these other things. The worst thing about the CDC is they said, try the other things first. Because this drug is so dangerous and it just causes all this dope fiends. And we're so afraid that we're recommending nobody take this. Well, that, saying it's now a secondary drug is forcing people into using things like ketamine that would be at the bottom of the list for failed treatments. These horrible things like Lyrica, which is, in my estimation, based on our little Twitter polls, horrible. I would not, I would, if people want to tell you to take ketamine, you say, okay, that's fine. First, we try the regular old-fashioned pain medicine. And if that fails, I'll be happy to consider this ketamine. And if they say, well, the pain medicines are dangerous, you can say, are they as dangerous as ketamine? Because ketamine is not approved by the FDA for pain.
I've actually had ketamine about 8 or 9 times for the disease I have, CRPS, complex regional pain syndrome. And it was so hit or miss for me. One, my doctor had me go off all my pain medication and it had to be out of my system. So it would take about 2-3 weeks for me to do that. And then I would get the ketamine infusion. Sometimes it worked, sometimes it wouldn't. And then when I would get the infusions, which is about 4 to 6 hours, I had no memory for anywhere between a day to sometimes a week. And I wouldn't track. So I stopped doing it because it wasn't beneficial. There was too many side effects, and I didn't want to do it. But I've heard some good things about it with other people. But that was personally for me, of me using it.
Yeah. And like I say, these are things that are at the bottom of the list you try when the opiate pain medicine fails.
Right.
There is nothing, and like our last caller said, nothing works like opiates.
Right.
And if you give enough, they work very well. And now with the AMA saying ignore these idiotic cutoffs over there at the CDC, hopefully people are going to change. And they put in there, too, about being arrested and stuff. So doctors maybe will start to feel like they've got some support from the AMA. The doctors should not be arrested. Pharmacists should not be arrested by the federal drug police because of milligram limits. And, that's what they're after right now. They're arresting doctors for, quote, prescribing too much.
Yeah.
bad. Okay. So.
Alrighty, well, we're going to wrap up here. I want to thank Charlie Brunn for coming on and sharing his personal experience. Thank you so much. And I think it's really good to be able to get an idea from somebody that isn't in the chronic pain community, isn't in this world, and it's just kind of like this newly happened to him. So it was really interesting to hear his point of view, because that's who we need to get to understand this. I think we need to get to have the normal person, everyday person, understand what is going on if we're going to fix this and change this. Do you agree with me, Dr. Kline?
I certainly do.
Yeah.
Yes.
So, is there anything you'd like to add before we get going?
I think for people suffering with no pain medicines, you need to put your stories together, because now there's a different story. The story is, now you've been off for months, years, and here's what happened to my life. And just tell the story like you would if you were getting the story from somebody else and writing a newspaper article. So it should be in journalistic style, not a lot of emotional language, just like our caller did. I can't go to my Thanksgiving with my family because the car ride hurts me so much to bounce around in the car that I've decided not to go. And start mailing these to your legislators, mail them to the governor. It doesn't matter. Just put them in envelopes and send them out. Mass mailings. When you get these circulars in the mail and you just throw them out, for a new furnace or something, the reason they do that is because if they get 2 or 3 people per 1,000 circulars, that pays for the circulars. So we need to do the same thing. We need to send out tons and tons, and maybe a couple of them will get in the right hands. So we're doing the circular kind of thing. So don't hesitate to, get somebody to read it, make a little, here's my story. Here's my story. My name is so-and-so. I'm 43 years old. I have 2 children. I'm a photographer. Paint the picture of who you are, and then paint the picture of what happened to you because you were taken off your medicines that worked for no medical reason.
Alrighty. Well, a big thank you to our audience for taking some time out of your evening to join us here at the Doctor's Corner. I'm Jonelle Elgoway with Dr. Kline, signing off until next Tuesday. Have a good evening.
Good night.
Thank you.
Bye, Charlie.
Goodbye, Charlie.
I didn't realize it.
This has been The Doctor's Corner with Dr. Kline and Jonelle Elgoway. Copyright 2018. All rights reserved.